What YST is, it's so simple. It's just asking kids who is in your life that cares about you, that you feel like you could talk to. We would train those people very briefly about how to support that child. And these people were amazing and they cared so much about these kids and they just needed to know what to do. There's been study after study looking at whether asking young people if they're thinking about suicide is harmful versus helpful. It is helpful. One of the major lessons is just this idea of making sure that kids know that they matter to the adults around them and that they feel like they belong.
Hello and welcome to Progress Report. This podcast is produced by the National Center for School Safety based out of the University of Michigan. We serve as the Stop School Violence Program's National Training and Technical Assistance Center, and we are focused on improving school safety and preventing school violence across the United States. This is the last episode in our Understanding Firearm-Related Injury and School Violence series. We will be exploring what schools can do to support students and combat firearm-related injury, as well as how community engagement helps reduce harm in the issues of school violence and youth suicide. Throughout the podcast, you'll hear the phrases firearm injury and gun violence. What we are really referring to here is injury or violence related to or involving firearms. To start off, who are you and what do you do?
My name is Cynthia Ewell Foster, and I'm a child clinical psychologist by training. Actually, I'm an associate professor in the Department of Psychiatry at Michigan Medicine, and am affiliated with U of M's Institute for Firearm Injury Prevention also.
What got you interested in this field?
So as I mentioned, I'm a child clinical psychologist by training. I'm a licensed clinician. And so I started my career doing a lot of clinical care for kids and families. I've also done a lot of clinical education. So, working with folks who are training to be psychologists, social workers, psychiatrists, but also along the way have been really consistently engaged in both research and public health evaluation. I specialize in suicide prevention. I think one of the things that I feel really fortunate to be able to do in my job is this blending together of both really understanding the experience of kids and families who are dealing with suicide risk, having an opportunity to develop and contribute to our scientific knowledge about how to prevent suicide. And then also in my role with public health evaluation, my collaboration with the Michigan Department of Health and Human Services and their injury and violence prevention section, I've gotten to walk alongside communities across the state of Michigan and support them in implementing what we've learned to be best practices in terms of suicide prevention. So it's like this wonderful mishmash of experiences. And, hopefully that'll be helpful to some of your listeners today. The thing that I'm really most interested in is how we can open our eyes and see the strengths that are existing in families and schools and communities and other systems that are around kids, how we can really optimize and maximize those strengths with the ultimate goal being preventing suicide in young people.
I like to ask in interviews, how did you find your way into this work?
Yeah, it's kind of fun to reflect back. I know you have a lot of listeners who are school people and educators and teachers. And it's funny, when I was in college, I knew very early that I loved working with kids. Like I was the person who was babysitting and a camp counselor and teaching ballet to 5-year-olds and, all that stuff. And I really thought I wanted to be a teacher. And then it became very clear that I didn't actually want to teach them anything. I just wanted to hang out and talk to them. And I thought, well, maybe I should be a psychologist. So I could just, talk with them. I just thought kids were so interesting and, what they had to say was so important. So anyway, I started my path in psychology that way. But my first research experience as an undergraduate, we were studying the intergenerational transmission of depression. So when moms had depression, how their depression impacted their parenting and how that impacted their kids. And we did a lot of interviews with kids about the stressors in their lives and what was hard for them versus, what was protecting them. And I think one of the big light bulbs that came for me in that experience in my 20s was, oh gosh, these systems that kids are living in, their families, their schools, their communities, their churches, they have this, great capacity to either be a protector for kids or to be a stressor for kids. And I think as a community, as a society, our interest is in making sure these systems are taking care of kids, and not being the thing that kids are talking to their therapist about as being the thing that is so hard for them, right? And I think, all of us who care about schools and care about kids, we want to be sure that kids are having a good experience with us. So that really kind of started my interest in these issues. And I actually didn't start working in suicide prevention until I got to the University of Michigan. I came to U of M as a postdoc and started working on suicide prevention, and again had a really formative experience. It was working on a research study of an intervention that was developed at the University of Michigan called the Youth Nominated Support Team. And we recruited kids who were on our inpatient unit at the University of Michigan. They were there because they were really seriously thinking about ending their lives, or they had tried. And this was a randomized controlled trial. So half of the kids in the study got YST. And what YST is so simple. It's just asking kids, who is in your life that cares about you, that you feel like you could talk to? And kids would nominate people. We would train those people very briefly about how to support that child in those months after their hospitalization, which is a really high risk time. And it was just a beautiful experience. There were homeroom teachers, math teachers, school counselors, grandparents, the neighbor, Sunday school teachers, your coach, high school soccer coach. And these people were amazing, and they cared so much about these kids, and they just needed to know what to do to try to protect these kids. And our findings for YST, when the study was over, were not that earth-shattering. But when we followed up with those kids 10 to 15 years later, we really saw the power of that intervention. And we lost many more kids who did not receive YST than we did kids who did receive YST. And so it's really one of our nation's few interventions that has a demonstrated impact on mortality for kids. And it's simple. And I love for people to know about it, because I think it empowers all of us to remember what we can do to support the kids that are in our communities.
While we are discussing these community support systems, I want to ask, what are some things that schools and their community partners can do to keep kids safe?
Yeah, I have a bunch of ideas. So let me start again with this idea of like upstream prevention and connectedness. And I thought I would just share, about another study that we worked on at U of M. So, YST, I talked about already. And for me, the message of YST is the support team, they didn't do anything that was rocket science. They got an hour's worth of education about what was going on with that kid. They had depression, or they had bipolar disorder. What is that? What does that look like? This kid's been in the hospital. They thought about ending their life. This is a really high risk time. What are some of the warning signs? And then really, we asked them to just call that kid once a week, check on him. How are you doing? You want to go out for ice cream? You want to go take a walk? What's going on in your life? Just be a caring presence, a caring adult in that child's life, and follow their lead. If they had something going on, they wanted to talk about it, great. If they didn't, no problem. And we also asked those folks to encourage the young person to stay in treatment, because a lot of kids, even if they can link to treatment, they don't stay in. And they really need their community to support them doing that. And so the kids who got YST, they did end up having more sessions of psychotherapy and more sessions of substance abuse treatment. So I think that was really powerful. One of the major lessons is just this idea of making sure that kids know that they matter to the adults around them, and that they feel like they belong. And so all of these issues around school climate and being a positive adult presence in a young person's life, I just think that we all need to remember that that is really critical. It's an evidence-based suicide prevention strategy. Related to that, the Centers for Disease Control and Prevention, one of their real focus areas in terms of suicide prevention is connectedness, right? The idea of making people feel connected to another individual, to their community, to their school. A number of years ago, our research team, led by Dr. Cheryl King, who's one of our nation's experts, was the PI for the Youth Nominated Support Team. We did a study that was funded by the CDC, trying to look at this idea of connectedness in kids. Is this a suicide prevention strategy? And the kids in our project were recruited from Flint, Michigan. And these kids had had just a lot of really challenging things happen in their lives. Just the exposure to violence, the bereavement, the economic challenges in families, just the losses that kids, the adversity. And what was so interesting is that despite all of that, just even at baseline, when we looked at, what predicts whether or not kids are thinking about suicide, if they felt connected to their school, they were less likely to be thinking about suicide. And I just want folks in schools to remember how much power there is in that, right? I mean, in this sample of kids who had so many things going wrong, if they felt like somebody at school cared about them, they were less likely to tell us that they were having symptoms of depression. They were less likely to tell us they were thinking about suicide. So please remember that what you're doing, making kids feel like they're important, is just, really, really critical. Okay, so that's one thing I wanted to highlight. I think another thing I really want to highlight and recommend, acknowledging capacity issues, is making sure that your school has initiated some kind of evidence-based gatekeeper training. We know that when someone is at risk for suicide, one of the most important life-saving things we can do is notice and talk about it, right? And there's a myth out there that I don't want to say the word suicide. I'm going to put the idea in their head. They're going to go and do it. It's going to be my fault because I gave them the idea. That is absolutely not true. There's been study after study, even randomized controlled trials, looking at, whether asking young people if they're thinking about suicide is harmful versus helpful. It is helpful. It's helpful. And so that's scary. I know most of us feel like a little bit of ick, and even saying the word suicide, you feel like you're getting in people's business. You're worried you're going to do it wrong. Please take a training. There are trainings that range in length from like 60 minutes all the way up to like 2 full days. But there are many accessible and available and cost-effective trainings for schools. And I really recommend that folks who are working with kids have that training. It's just critical. There's lots of guidance out there about how schools can develop helpful protocols for teachers too. Like if they're worried about a kid, they have the training, they ask, well, then what? Then what should I do? So really giving people guidance inside the school system about those protocols for risk identification and getting kids help and talking to parents and all that kind of stuff. The more we can follow a cookbook, the more likely we are to do those things. So I think that's another recommendation. I think the last one is to really think about how we can provide education to families about firearm safety. So I'm going to kind of circle back to that issue of firearms. So I hear a lot from folks. We talked a second ago about that myth, like, oh, I don't want to say the word suicide. I don't want to ask about it. People are it's going to put the idea in people's heads. Not true. I think another myth that we hear a lot in the field of suicide prevention is if somebody really wants to end their lives, they're going to find a way to do it. And whether or not there's a firearm available isn't really relevant. And it's just not true. So what could schools do related to this? It's a family education, opportunity, right? To kind of dispel some of those myths, encourage people to be storing safely. Here in Michigan, we have some new legislation that's just passed around child access protection laws. Schools could help educate families about what that law means and how they could be adherent to that. In my own school district, when we do our back to school paperwork now, there is a blurb. And, when I'm giving everybody's emergency contact information and their allergies, and do they have, my permission to have medication at school, all those things that you do in August, we now have a blurb that, gives some really important information about firearm safety for kids. And we're asked to sign a pledge for that we're storing safely. And, I think some of those things are opportunities for schools. Certainly there's a lot to learn, about the effectiveness of that from a research standpoint, but I was pretty excited to see that in my own back to school paperwork.
A big concern that folks have been sharing with us is capacity in terms of reductions in staff, turnover, and struggling to find teachers, substitute teachers, and support staff. Do you have any thoughts or advice for educators that have been dealing with these issues?
I should say, I'm a parent. I have 3 kids in public schools. I have so many dear friends in education. And, it's been a really hard time to be in education. And, I started this conversation talking about the kids, right? But the whole analogy, when the plane is going down, affix your mask first before your child. And not that the plane is going down, but I just think it's really important that we all are mindful about the mental health and the well-being of our educators and people that are working in education. It's been a really hard time. And I am concerned about, the number of things that we're asking our educators to do for kids. So I certainly hope that what I'm saying isn't received as like, oh my gosh, it's one more thing that I'm supposed to be doing. And I do think that is a challenge, and capacity is a challenge, and we all can only do what we can do. And we have to make sure that we're, taking care of our own mental health and well-being before we start trying to take care of other people. So I think I just want to say thank you to everybody. I feel like I go to every parent-teacher conference for my own kids, and I start by saying, thank you for not quitting during COVID. Thank you for staying. Thank you. My kids are so lucky that you're still here. So I extend that out to everybody listening. Thanks for just showing up every day and caring about the kids that are in your community.
What resources would you recommend folks check out?
I should share that I'm also happy to send you the link to the paper about YST. So if anyone is interested in reading more about that, there's also a great guide that SAMHSA just put out around different interventions for youth suicide prevention. YST is covered in that, and that's free and publicly available if people don't have access to, scholarly journals. So I'm happy to share some of those links with you.
Those resources can be found in the episode description. As a quick summary, in this series we have learned that means matter for cases of school violence, youth suicide, and youth intimate partner violence. So an important part of harm reduction for these issues is locking up firearms safely and securely. We discussed how policy can be used to combat firearm violence with funding allocations and extreme risk protection orders, which are civil court orders that restrict access to firearms for people who are deemed at risk of hurting themselves or others. We got an overview of how research can be used to identify the best practices and most effective programs in school safety. Lastly, we talked about the importance of community engagement in keeping kids safe. Before we conclude, are there any other thoughts that you would like to share?
Yeah, I just want to thank again, all of our colleagues who are working in education and supporting schools and supporting kids. Thank you, thank you, thank you. I think there's a lot of worry about how kids are doing right now. We're talking about a children's mental health crisis, and I know that it's really difficult to think about asking a kid if they're struggling when you know that the therapist in your town have a 12-week waiting list. I think, all those things are real, and their barriers and their challenges. But, I guess I would just like to end with a message of hope and encouragement. The way that we change this dynamic is that everybody has to play a role. Everybody has to get out of their comfort zone a little bit. We all have to do something a little bit different than what we've been doing for the past 20 years. I think if we keep doing the same thing, we're going to see this pediatric mortality rate continue to increase as it has been. 2021 was the first year that pediatric mortality increased in the United States, and it's not acceptable. So I just, want to encourage you. I know it's hard. I know sometimes it's scary to, do something different, but I think, there's many of us who are here to support you, and thank you for what you're doing for kids.
Thank you for tuning into this episode. For more information about the National Center for School Safety, visit our website, nc2s.org. You can also check us out on Twitter and Facebook. This episode of Progress Report was produced by the National Center for School Safety at the University of Michigan. Additional resources and information can be found in the show notes, and music is thanks to Mackay Beats. This project was supported by Cooperative Agreement number 2019-YS-BX-K001, awarded by the Bureau of Justice Assistance. The Bureau of Justice Assistance is a component of the U.S. Department of Justice's Office of Justice Programs, which also includes the Bureau of Justice Statistics, the National Institute of Justice, the Office of Juvenile Justice and Delinquency Prevention, the Office for Victims of Crime, and the Office of Sex Offender Sentencing, Monitoring, Apprehending, Registering, and Tracking. Points of view or opinions in this document are those of the author and do not necessarily represent the official position or policies of the U.S. Department of Justice.